Welcome to the Health Inquiry. Today, we are talking about a massive medical revolution that is completely changing how doctors protect your health. For decades, if you went to the doctor, medicine treated your body like a bunch of separate departments. If you gained weight, you talked about obesity. If your blood sugar spiked, you were treated for diabetes. If your blood pressure went up, it was a heart issue. And if your labs looked off, it was a kidney problem. But a major medical guideline called 2026 AHA, ACC, ADA, ASN Guideline for the Prevention, Detection, Evaluation, and Management of Cardiovascular-Kidney-Metabolic Syndrome has officially retired that old way of thinking. Doctors have realized that your heart, your kidneys, and your metabolism are actually best friends, or worst enemies, depending on how you treat them. When one starts to fail, it drags the others down with it in a domino effect. This interconnected web is now officially called Cardiovascular-Kidney-Metabolic Syndrome, or CKM syndrome for short. In this video, we're going to break down exactly what CKM syndrome is, the 5 stages of risk, and the life-saving tools doctors are using to protect your organs before it's too late. If you want to know how your body actually works, stick around. The 5 stages of CKM syndrome. Where do you stand? To help understand your risk, the guideline breaks CKM syndrome down into 5 distinct stages, starting at a perfectly healthy stage 0 all the way up to stage 4. Let's look at how a person moves down this track. Stage 0 means no risk factors. People in stage 0 are completely healthy. They have a normal body weight, perfect blood sugar, healthy blood pressure, normal cholesterol, and perfectly working kidneys. Because health problems tend to pop up as we age, stage 0 is most commonly found in children, teenagers, and young adults. The goal here is simple, pure prevention. Eat well, stay active, and protect that perfect baseline. Stage 1 is excess or dysfunctional fat. This is where the first domino tips. A person enters stage 1 if they carry excess or unhealthy body fat, but they don't have full-blown high blood pressure or organ damage yet. Doctors spot this if your body mass index, BMI, hits 25 or higher, if your waist circumference is wide, meaning 88 centimeters or more for women and 102 centimeters or more for men, or if you have prediabetes, which means your blood sugar is elevated but hasn't become type 2 diabetes yet. The goal in stage 1 is to stop the disease in its tracks through lifestyle adjustments and targeted weight loss. Stage 2 is metabolic risk factors and early kidney disease. In this stage, that unhealthy body fat starts actively rewriting your body's chemistry and damaging your internal systems. You land in stage 2 if you develop full type 2 diabetes, high blood pressure of 138 or higher, high triglycerides, which are unhealthy fats in your blood, or early to moderate chronic kidney disease. Stage 3 is subclinical heart disease. The word subclinical is incredibly important here. It means you have active, physical damage happening inside your heart, but you feel completely fine and have 0 symptoms. No chest pain, no shortness of breath, nothing. Doctors catch stage 3 using specialized tests, like a heart scan looking for hardened plaque in your arteries, or blood tests that check for hidden heart strain. Stage 3 also includes anyone who already has severe kidney disease or a mathematically calculated 10-year heart attack risk of 20% or higher. Finally, stage 4 is clinical cardiovascular disease. This is the most advanced stage, where a person has CKM risk factors like obesity or diabetes and has developed active, symptomatic heart disease. This includes having a history of a heart attack, a stroke, heart failure, where the heart can't pump blood effectively, or atrial fibrillation, which is a dangerous, irregular heartbeat. The doctor's toolkit, tracking your real risk. So, how do doctors know exactly where you stand and how aggressive your treatment needs to be? They don't just guess, they use some incredible tracking tools. First is a powerful mathematical model called the Prevent Risk Equations. If you are an adult between 30 and 79 without existing heart disease, your doctor can plug your age, blood pressure, cholesterol, BMI, and kidney function into this calculator. It will spit out your precise 10-year and 30-year risk of suffering a heart attack, stroke, or heart failure. If your 10-year risk is 20% or higher, your risk is just as high as someone who has already had a heart attack, so you are automatically bumped to stage 3 to get immediate, aggressive protection. For younger adults between 30 and 59, looking at that longer 30-year risk window is a game changer. It catches long-term dangers early, giving you a chance to fix your habits before permanent damage happens. Second, doctors are completely changing how they look at kidney health. To find hidden kidney disease, a simple blood test isn't enough anymore. Doctors must check 2 things together. They check your blood for a score called eGFR, which tracks how well your kidneys filter out waste. And they check your urine for a score called UACR, which looks for protein leaking into your urine. Healthy kidneys keep protein in your blood, so if protein is leaking out, it's an early warning sign that your kidneys are under severe stress. By the way, CKM syndrome can start early in life. Because kids and teenagers are still growing, doctors don't use fixed numbers for things like BMI and blood pressure in youth under 18. Instead, they use pediatric growth charts and percentiles to catch weight and blood pressure issues early. The hidden risk factors: environment, sleep, and history. Now, health is about more than just your blood work and biology. The 2026 guideline makes it clear that your daily environment and your personal history drastically change your risk of advancing through the CKM stages. First, let's talk about social determinants of health. These are the non-medical conditions of your life that affect your well-being. Doctors are now urged to routinely screen patients for things like food insecurity, not having reliable access to affordable, nutritious food, housing instability, living in unsafe or crowded conditions, transportation barriers, lacking a way to get to the pharmacy or doctor, and financial strain, struggling to pay basic bills. If you can't afford healthy food or your medication, your CKM syndrome will get worse, which is why treating these social needs is now a core part of modern medicine. There are also physical conditions that act as risk enhancers, meaning they amplify your chances of heart and kidney damage. These include chronic inflammatory conditions like rheumatoid arthritis or lupus, a family history of diabetes or kidney failure, and severe psychological health struggles like depression or anxiety. There are also sex-specific risk factors, like early menopause before age 40, polycystic ovarian syndrome, erectile dysfunction, and a history of adverse pregnancy outcomes. If a person experiences high blood pressure or gestational diabetes during pregnancy, it acts like a natural stress test on the body. The guideline highlights that these individuals have a much higher risk of developing permanent diabetes or heart disease later in life, meaning they need thorough checkups within their first year postpartum to protect their long-term health. Organ protectors: how doctors treat CKM syndrome. Because all these organs are connected, your care team shouldn't be working in silos. The guideline strongly recommends interdisciplinary care teams. Imagine your primary doctor, your heart specialist, your kidney doctor, your hormone doctor, and a dietitian all working together under one coordinated care manager. This point person helps you navigate your appointments, tracks your medications, and connects you with community resources if you are struggling with food or costs. When it comes to treatment, doctors focus on your specific risk profile using medications that have multi-organ benefits, meaning one pill can protect multiple organs at the exact same time. If your primary risk is obesity, weight management is everything. Carrying unhealthy body fat drives insulin resistance and system-wide inflammation. Lifestyle changes are always the foundation, but if diet and exercise aren't enough, doctors can add highly effective GLP-1-based therapies, like semaglutide or tirzepatide. These medications control hunger and metabolism, helping people shed weight while lowering blood pressure and inflammation. For severe obesity, metabolic and bariatric surgery is incredibly effective, often triggering long-term remission of diabetes and drastically lowering the risk of heart attacks. If your primary risk is type 2 diabetes, the goal is no longer just lowering a blood sugar number, it's about deploying organ shields. Doctors will prioritize SGLT2 inhibitors, which help your kidneys flush excess sugar out through your urine and are proven to drastically reduce heart failure hospitalizations. They will also use GLP-1 receptor agonists, which excel at stopping the fatty plaque buildup that causes heart attacks and strokes. If your primary risk is chronic kidney disease, doctors use a multi-step defense. First-line therapies include a RAS inhibitor to stop protein from leaking out of the kidneys, combined with an SGLT2 inhibitor to protect kidney function. If a patient's urine still shows protein leakage after that, doctors will add a specialized second-line medication, like a drug called Finerenone or a GLP-1 therapy, to stop kidney failure from progressing. Managing the extras: fatty liver, sleep apnea, and safety. Before we wrap up, we have to talk about three massive conditions that frequently tag along with CKM syndrome and must be managed. The first is MASLD, formerly known as fatty liver disease. This happens when excess fat gets packed inside your liver, causing chronic inflammation that can lead to liver cirrhosis or cancer. Because it has zero early symptoms, the guideline recommends that adults with diabetes or multiple metabolic risks get a regular score calculated called the FIB-4 index. This simple calculation uses your age and standard blood tests to see if your liver is developing dangerous scar tissue. The good news? Losing 10% or more of your body weight can actually cure it, and GLP-1 medications are highly recommended because they directly reverse liver inflammation. The second is obstructive sleep apnea. This is when you repeatedly stop breathing at night, usually because excess weight tissue pinches your airway shut. This constant nightly suffocation spikes your blood pressure and accelerates heart damage. While a CPAP machine keeps your airway open and fixes daytime sleepiness, significant weight loss is the ultimate key to reducing or curing sleep apnea entirely. Finally, a quick note on safety monitoring. Many of these advanced CKM medications change how your body handles fluids and minerals. If you start a RAS inhibitor or an MRA, your doctor must recheck your kidney function and blood potassium levels within 2 to 4 weeks. A mild drop in kidney function of up to 30% is completely normal and means the medication is working to protect the organ. But if your potassium spikes too high, it can affect your heart rhythm, so close tracking is required to keep you safe. Conclusion: take charge of your health. The main take-home message from new guideline is simple: your body is an interconnected ecosystem. Obesity, diabetes, kidney disease, and heart disease are all branches of the exact same tree. By understanding your CKM stage, tracking your risk factors, and using modern, organ-protecting treatments, you can prevent disease progression and live a longer, healthier life. Talk to your doctor about your CKM health, ask about your kidney tracking scores, and find out what your long-term risk looks like. If you found this video helpful, please hit that like button, subscribe for more public health updates, and share this with someone you care about. Stay healthy, and I'll see you in the next video.